Welcome back. When I first started injury practice, I knew one thing that I had to have was a chiropractor. Fortunately for me, I was an officer in the Louis A. Martinet Legal Society here in Baton Rouge. That's the Black Lawyers Association here in Baton Rouge. In that interaction, I was able to come in contact with Dr. Gerard Bell of Capital Spine and Rehabilitation. Since that meeting some years ago, Dr. Bell and I have been in business together from the standpoint of him seeing my clients and treating them very well from the standpoint of his chiropractic care. So with that, I would like to allow you to welcome on Dr. Gerard Bell of Capital Spine and Rehab. Thanks for joining us today, Doc.
Thank you for having me, Mike.
All right. So a lot of people out there aren't too familiar with chiropractic care. I'm sure they've heard the term chiropractic care, or the phrase, shall I say, chiropractic care, but I don't think they're too familiar with what it is. Can you just give us a brief synopsis of what chiropractic care entails?
Chiropractic care entails evaluation by a physician, diagnosis of a patient by a physician by utilizing x-ray, certainly utilizing the physician's orthopedic and neurological skills, and a treatment plan placed in order, which predominantly is using manual medicine to correct, I would say, disorders of the spine and ailments of the body.
So now, is chiropractic care solely related to treating the spine, or do you guys treat other parts of the body as well?
We certainly treat other parts of the body. We treat shoulders, we treat elbows and wrists, as far as that encompasses the actual upper limb. We certainly treat the hips, knees, and ankles as well. But everything resolves back to the spine. And so if I'm treating your spine, I can effectively, also at the same rate, treat your upper limbs and your lower limbs, because nerves run throughout the entire body.
Okay. So let's say there's an individual out there watching today and they want to aspire to become a chiropractor. What do they have to do from an educational standpoint in order to become a chiropractor?
Well, first, they certainly have to have a high school education. They have to finish a 4-year program at a university as far as getting a baccalaureate degree and apply to be accepted into chiropractic school, just like they were applying to medical school or dental school. From there, they would move into, can choose a school that has an accelerated program, whereby a 3-year fast-track chiropractic program, certainly is the one I did in Dallas, Texas at Parker College of Chiropractic. But there are other schools that are for a longer duration, between 3.5 to 4 years. And so you complete that program, which is, I would say, pretty heavy in academia, and also do clinicals, which in chiropractic care, in the chiropractic education, we do not actually have a residency that we actually do, but we have an internship in clinicals that we actually have to accomplish. And once graduating from our clinical experience, as well as our academic experience, we certainly have to sit for our board examinations. Upon finishing our board examinations and passing them with a passing score, certainly we can obtain our license by going to a respective state that we want to travel in and pass the jurisprudence exam there. And so from there, we actually are licensed to practice.
Okay. So let's take a look at it from now a new client intake perspective. I think most people watching today would probably view chiropractic care as being associated to getting some type of treatment because you've been through some form of trauma or an accident. What is your philosophy on how people should approach or think about getting chiropractic care? Should they look at it from the standpoint of, oh, I just need it after an accident, or should they look into infusing chiropractic care into a part of their individual wellness program?
My philosophy is certain that everyone should actually, I would say, make a educated decision to invest chiropractic as a part of their lives. Chiropractic wasn't originally started because of trauma. It certainly was started from an actual symptom that an individual had, but it was certainly immediately after that was advocated for individuals to visit chiropractic for spinal hygiene. Our actual cells inside our discs and our back only live for 60 days. After 60 days, those cells have to be regenerated to grow, to keep our disc healthy, to keep our disc well hydrated. So with that being said, if your cells inside your disc only live for 60 days, then every 60 days, every 2 months, you should actually see your chiropractic physician to actually have your spine stimulated or have those cells stimulated so they keep regrowing. The reason why those cells would be apprehended from growing is that your spine gets restricted in movement, and lack of movement allows for your disc to become very unhealthy. Your chiropractor's job is actually to decompress that disc, mobilize that disc, so that that disc stays healthy and so that it stays youthful, and that as a result, the patient can stand up straighter and taller, but more importantly, their brain can actually maximize its communication down that vertebral column out to muscles, joints, and organs for the body could function at an optimal level. So with that, all that being said, long story short, wellness is certainly a great investment with chiropractic inside everyone's lives. And you should see a chiropractic physician 6 times a year. On the other hand, certainly if you have any problems at all, from headaches, neck pain, back pain, we welcome those patients with spinal disorders to come into the chiropractic office to be treated for those ailments and to help those to resolve. So that person can get back to functional life and be happy.
Now, in my experience here in the area, I know there are quite a few chiropractors, just like there are quite a few attorneys. Mm-hmm. From the standpoint of the services that you provide, why should our public choose you over, let's say, any that's out there? What differentiates your practice from maybe someone else's?
What differentiates Capital Spinal Rehabilitation from the other offices in the greater Baton Rouge area is that myself and my wife, my business partner, we practice the Cox technique, which is actually short for Cox Flexion Distraction Spinal Decompressor Technique. We are one of the very few offices in the Baton Rouge area that provide this service, along with a lot of additional ancillary services. But I want to focus in on the Cox technique because this technique specializes actually in decompressing the spine and treating serious spinal disorders. We're not just speaking of a simple sprain strain, which may be an injury to a muscle or a tendon or a ligament, but we're talking about individuals that suffer with severe arthritic conditions, and those people need our help, or people that actually suffer from injured discs, and those people certainly need our help, and also individuals that suffer with pinched nerves, whether it be down their respective arm or leg, and those people definitely need our help. These are neurological and orthopedic conditions that people, most of the general public, only think that the orthopedic physician or neurosurgeons are the answer for them. Well, we are the answer for them when they do not want to have surgery or they do not need to have surgery. And most of the patients that do suffer with these conditions, most of them don't require to actually have surgery. So the best solution for them is actually to be seen by a chiropractic physician and one that actually specializes in the Cox technique, because it's the most effective orthopedically inclined chiropractic procedure in the world, and certainly as of today, it's the only chiropractic procedure in the country, that the federal government has been doing research behind chiropractic since the 90s. So with the research credibility and with the effectiveness of the procedure, it's hands down the #1 choice non-surgical procedure for treating spinal conditions.
Well, thank you very much, Doc. And we flashed your number up on the screen so that the people out here can get in touch with you. Right now, I would like to thank you for coming by. Thank you for lending your talents and times to the Wellness Hour.
Thank you, guys.
And I would like to thank you for tuning in. Till next time.